Hi, everybody. Good evening. This is evening, and welcome to Conversations with Calvin, We the Species. It's a Wednesday night, August 18th, and this is my little sizzle reel to introduce Kelly PICCIURRO, who is a doctor of physical therapy. And I'm so excited about this because if I ever came back for another run, I would have chosen to become a doctor of physical therapy because I am such a believer in it and I love it. And to have Kelly, who graduated from Rutgers University, became a doctor of physical therapy. But we're going to talk about in this interview, we're going to talk about the fact that she loves one-on-one and manual and holistic and Pilates and Kinesio Taping and posture and the best kind of posture. The fact that she does such a variety of orthopedic and musculoskeletal types of physical therapy, injury prevention, and returning to physical activity, i.e. after sitting around for a year during the pandemic. So there's a lot of things to unpack, and the sizzle reel is over, and it gives me really, I told you before, when I have really looking forward to this time with you, Kelly. So take it away. How about a little bio, and then we'll kind of jump into some topics.
Sure. Well, first of all, I just want to say thank you so much for having me. You have had, quite the list of impressive guests. So I am very honored to be part of this. It's a really great thing that you're doing. So I'm very excited to be here. A little bit about myself. I've been a physical therapist for 5 years, and I've been working at Spring Forward Physical Therapy, and we're located in Midtown Manhattan. I specialize in orthopedics in an outpatient setting. So pretty much anything musculoskeletal, so anything involving muscles, bones, joints, ligaments. So that could be tears in muscles, tears in ligaments. It could be sprains, it could be fractures, it could be breaks, anything along those lines from head to toe. So I've seen it all, just generalized neck and back pain, a lot of postural related disorders. That is my specialty. I have a pretty holistic approach to my treatment. So I look at the whole body, I look at the whole person. If you come in for a knee pain, I'm going to look at your low back, I'm going to look at your hip, I'm going to look at your ankle. So I try to treat really holistically, and I do incorporate Pilates in my treatment. I think Pilates-based exercises are great for rehab. I also do a lot of manual therapy. So I spend a lot of time doing one-on-one care with my patients, all hands-on therapy. I specifically look for a practice that would allow me to do that, as opposed to, only being able to spend a couple of minutes with each patient. So I really enjoy spending the time, using my hands, getting to know my patients, and all of that. Like you said, I got my doctorate from Rutgers University. And yeah, I think that's pretty much everything.
Okay, so we'll jump into some specifics.
Yeah.
By the way, the commonality I alluded to, the fact that you're Rutgers, obviously. Yep. I am. In undergrad, you were at Maryland, another Big Ten school. So these things are all important.
Yes.
To me, I love our conference. By the way, football 3 weeks away. Boom.
Coming up.
Yeah, and it's been 2 years, so
yes.
That's kind of how and why did you go into physical therapy?
So I always knew I wanted to explore something in the medical field. I was actually very interested in psychology. So I graduated University of Maryland with a bachelor's in psychology. I wasn't sure what I wanted to do with that, if I wanted to go to grad school. I toyed around with med school to become a psychiatrist, or even different types of doctors. I looked at nursing, I looked at physician's assistant. So I took the time out to really shadow and volunteer at different places. And what I like most about physical therapy is the one-on-one care and the time spent with the patient. So I found that in a lot of these doctors' offices, you maybe see the patient once or twice a year. Of course, it depends on the type of doctor. But it wasn't as personable as physical therapy was, where typically when you see somebody with an injury, they're coming in once a week, twice a week, up to 3 times a week. So you're seeing them regularly. You're getting to know them, which was my favorite part. But even on top of that, just watching them progress, watching them meet their goals, it was extremely, extremely rewarding. So I think that's what drew me to physical therapy, really that personal aspect of the profession. I did have some injuries growing up. I was a dancer, nothing major, but I also had some physical therapy growing up, and it helped me immensely. So, you know, I knew that it could be extremely helpful.
Okay. Next,
Yes.
Posture. I know I have terrible posture. I actually sit in this chair. It's funny, we talked a whole bunch a couple times, and I never even brought that up. I was never trying to get free advice,
Yeah.
treatment, but are there good ways, ideal ways to sit? And by the way, the whole notion of posture. Also, we just chatted about this too. Is I did my research that you have some of the world's greatest writers, American writers, who actually stood. And I sit in this chair literally 18 hours a day. I do get up and walk around every 15, 20 minutes because, you know, you got to get the blood flowing. But anyway, talk about posture.
Yes. Well, my number one recommendation is to always stand up at least once an hour. Every 20 minutes is amazing, but you never want to be in any position for too long. So that's great that, you know, you make it a point to stand up. Yeah, posture is a very prevalent topic. We're all on our phones, we're all looking down, and you know, now with most of the population working from home, they might not have the ideal chair or a monitor. So it's definitely become more relevant in the last, you know, year or so. I'm personally not in a great chair right now, but I have a good excuse because I don't work from home, so I don't have a desk chair here. But if you are, you know, sitting in a chair most of your day, whether you're at home or in the office, you really want to invest in an ergonomic chair. You can get it from Amazon, but just a good desk chair, not a dining room chair, not a wooden chair, not a folding chair. A good cushioned desk chair that's adjustable in height and has armrests, really important. A couple of quick tips is if you're using a laptop, ideally you want it a little bit elevated, right? So you want it at eye level, because when it's flat on the table and you're typing, you kind of tend to do this. So you're looking down and you're slouching. If the laptop is up here, you know, you're sitting more so like this as you do your work. If you have a monitor, the monitor is probably at an appropriate height. If you have a laptop and you elevate it, you can put it on a couple of textbooks. You can buy a laptop stand. Then I would recommend getting a detachable keyboard so the keyboard can be on the desk, because if you do elevate your laptop, then you don't want your hands and your shoulders hiked to type. So a couple of moving parts there. But ideally the screen should be at eye level. Your elbows, we can adjust this a bit. Your elbows should be at 90 degrees, so comfortable on the table. If you have an adjustable chair, you can move the chair up or down to get the correct elbow position. And then you want your feet flat on the floor. So again, if you have to lift your chair up and your feet dangle, you might want to get a couple of textbooks or a foot stand, but you want your feet flat on the floor. Try not to cross your legs. You know, feet nice and even. If you do have a good chair, you'll probably have some decent back support, but you want your back, you know, nicely supported up against the chair. And then any objects that you use throughout the day, you want them, you know, within reaching distance, so you don't have to overly reach and bend your spine and whatnot to get to certain objects. Another common question that I get, a lot of people have a couple dual monitors. So if you are working with two monitors and you have to turn side to side, and you're on a swivel chair, I recommend, turning the whole body as a unit, as opposed to just, turning your neck or having your neck turned and typing throughout your day. So really try to keep everything nice and neutral, which I know is easier said than done, but it makes a big difference.
Wow. Well, it's like, wow.
There's a lot to think about.
There's an awful lot
Yes.
to think about, and I'm listening to you. Fortunately, my it is really a wow, and I it's so involved, and I do stretching exercises for my back. When I was joined the gym a few years ago, they gave me some stretching, and I do some of the stretching. But the reason why I'm telling you this, the importance, the subtle importance of everything you said, and I was stretching my neck back, and over the last few months, I felt like my neck was sunburned, and I kept scratching it and scratching it. I'm doing it now, and a friend of mine's a dermatologist, and I said I can't stop scratching, and he said it's from. Smart guy. He said it's because I'm doing this stretching and my neck wasn't used to it. I inflamed the nerves.
Yeah.
Wow.
Yes.
Wow. So that it's so interesting listening, and because you never even think of this stuff. So early on, when you and I got connected, I kind of read about some of your background. Been in Spring Ford, et cetera, in the city. But what impressed me, and we discussed this before we went on air, is the fact that you love hands-on manual therapy. And my first indoctrination, in not necessarily a positive way, was with a physical therapist decades ago who wasn't into hands-on. So talk about the hands-on, the manual stuff that's your specialty.
Yes. So typically when you have pain or an injury, right, it either maybe comes on randomly, or it develops over time, or there was an accident or an incident to bring it on. Regardless of the scenario, is things change throughout the whole body, and that kind of ties into with the holistic approach. So let's say you randomly develop knee pain, gets worse over a couple of weeks. Why did you develop that knee pain? We need to get to the why in order to fix it and prevent it coming back. I can, treat your knee, do a little massage, give you some ice, and I can make your knee feel better. But if I don't get to the root cause, then long-term, it's not going to be solved. So typically with manual therapy, you do a complete assessment, and I'm looking at different structures, what seems off. Maybe are your hips rotated or twisted? Is one hip higher than the other? Does your kneecap move well? So we're assessing all these things. And then again, the holistic approach plays, because maybe you develop knee pain because your hip was rotated backwards, or maybe you develop knee pain because you have an unstable ankle, right? So that's kind of when you want to look at the whole picture. And then you have to do the manual therapy to correct those imbalances. So I might have to mobilize your hip joint to get it in proper alignment. So then when you're walking, your knee moves correctly. Or I might have to release your quad muscle, because maybe your quad muscle in your leg is pulling on your knee the wrong way, and that's causing the pain. So we're kind of detectives in the way. We have to pretty much pick apart the imperfections, and really feel with our hands, and also see what might be going on. And then the best way to fix it or to move something is really through manual therapy. So there's mobilizations which apply to your joints and your bones. So it's not painful. It's fairly light, but I basically push on a structure in order to get it back where it needs to be. And then there's different soft tissue techniques. So different techniques you'll do on muscles, releasing muscles, stretching muscles, and whatnot. And then the same thing goes for if you had a fall or an accident, something happened, something is now off, and whatever is off needs to be fixed manually. So exercise is important too, but sometimes you can't get to that until all the structural pieces are fixed and in place.
I love what you said. What you do, you have to be a detective. I
Yes.
thought that was great, because you really do have to be.
Yeah.
So, what a world, listening to you, getting to know you, and going back a couple decades. What a world of difference from what I first experienced in your profession, and listening to you now. What a world. I always quote Aldous Huxley, who wrote Brave New World, because it is, listening to you, it is a brave new world. So part of your expertise in your practice is Pilates, which I don't know anything about. Talk about how you brought that into your
Sure.
practice.
So then, kind of segueing from the manual therapy to the exercise, Pilates is, it's a form of exercise. So it includes strengthening, it includes a little bit of flexibility. It's very postural focused, it's very holistic, and it includes breathing and mental awareness. So there's a lot of components to it, but it's, a very holistic full body approach. It typically is small and controlled movements to focus on the smaller stability muscles, which a lot of times are weak, and that's why people may injure themselves. So, if you're active and you work out and you go to the gym, most people know the bigger muscles, and you do squats for your quads and you do bicep curls. But there's all these small muscles in the shoulder and the hip and in the leg that really play an important role in stabilizing the joints to avoid injury, or to avoid those joints moving out of place. And Pilates works all those muscles. So it's very small and controlled movements. It's typically pain-free. So it's great for people after surgery or people in pain, because the movements are so small, they won't really induce pain or make the pain worse. And like I said, it focuses on some mental awareness, some breathing, a little relaxation. It's also very core focused. So even if you're doing an ankle exercise, I typically cue my patients to engage their core muscles and hold their abdominals in. So it's very, very full body and great for rehab. Yes.
And I knew nothing about that. So interesting. I do my little routines, which is a holdover from being at the gym, and I know when I do some weights, I naturally try to tighten my stomach muscles.
Good, that's great.
Yeah, and I'm listening to you. It's not Pilates what I do, but it's really interesting. I think this next question is kind of hugely important. Somebody's been sitting home for a year because of the pandemic, and actually this is ongoing. The pandemic is back. So what would you recommend? What are the steps to go back?
Yes. So the key to going back, really in a nutshell, is just to start out slow. If you start out slow, you're not going to injure yourself, and you won't feel too much soreness, and you won't feel too much pain. So, it depends on what you did, but if you used to weight lift and you used to bench press, start with 50% of what you used to do.
Okay.
50% of the weight and 50% of the reps and sets. So if you were doing 30, just start with 15. I know it sounds a little bit low and simple, but again, our bodies are all deconditioned from sitting home and not doing the workout. So you're not going to be where you were a year ago. The same thing goes for running. If pre-pandemic you were running 10 miles 3 days a week, start off 1 day a week, run 3 miles, see how your body feels the next day, up it to 5 miles next week, maybe twice that following week, and just a slow, gradual increase really pay attention to how your body feels. And if all is well, then, there's no harm in increasing weight or repetitions. So, I know we're all so eager to get back to what we're doing, and we all think we can just, pick up where we left off, but it's definitely can be a little harmful, or a little bit of injury inducing. So just slow. Yeah.
I like that 50% thing.
Yeah.
I pushed myself. We discussed this, and I pushed myself from day one of the pandemic, and I've been in the house 500 days, give or take. I did sneak out to go to Rutgers. Oh, by the way, I did sneak out a few months ago to go to Rutgers, Maryland, track meet.
Oh, wow.
Yeah, and Penn State. I always leave them out for one reason or another. I don't know why. But what I wanted to say is I've been so avid exercising. We discussed this, and I'm a great believer, and of course you are too, that this object up here,
yes,
grab my head, thrives on physical exercise, and it grows, and one day I'm going to come into Manhattan and maybe visit you at Springford, but also go to a lab. There's one lab in Manhattan that measures your telomeres. That's the tips of the cerebral telomeres in your brain that keep your brain functioning well. And the theory is, as you get older, it's like a tip of a shoelace, actually. And as you get older, and it protects the chromosome and the stuff up here. So as you get older, the tip actually gets shorter and shorter, and then eventually kind of leaves you prone to all kinds of things. And but they found that physical exercise, an appreciable amount, constant in a way of life, keeps those cerebral telomeres, those little tips, pretty long. And so I'm curious what all this life of exercise has done.
Yes.
Someday I'm going to do that.
Yeah,
you can walk in off the street, I think, and get your.
Oh, wow.
Yeah, I have to find. I haven't done it, but one day I will.
Yes.
So, off topic.
Yeah.
I forewarned you, Kelly. Just one quick off topic question that I love to ask. So here it is, and it's one word, a couple words, whatever. But excluding family or friends, somebody living or dead you'd like to spend a day with. It could be none. It could be one, two, whatever. Shall I repeat it? Excluding family or friends, somebody living or dead you'd like to spend a day with. It's a cool question.
That is a cool question. Oh gosh, I feel like I have to think about this one.
Well, you probably should, because you could probably come up with dozens. You don't have to come up with any or whatever. It is cool.
Okay, I'm gonna go with, I think, let me just make sure I'm not leaving anyone else out.
There is no grade to this. So
I think I'm gonna go with Oprah.
Cool.
Yes.
Very cool.
Yes.
Yes, she is amazing. I actually met her.
Oh, wow.
Yeah, it's a long story. A couple of years ago, I was invited to go to Dr. Oz. She had just produced a movie, The Immortal Life of Henrietta Lacks.
Yes,
And
I read that book.
She started it, with all the things they did to Henrietta, and they used, they used her cells. So a friend of mine's son was a producer of Dr. Oz, and I always, it's funny, I wanted to meet her too for for all kinds of reasons. And we had VIP seats, and I knew I'd be sitting
Wow.
in the first row near her and Dr. Oz and the star of the movie and the woman whom I forget who wrote the book.
Mm-hmm.
So they were all there, and I was sitting, and I knew
Wow.
I'd be sitting literally a few feet away, and they wouldn't let me wear my Rutgers hat.
Oh,
They made me take it off.
they did.
Yeah, because you can't promote. But I wore the craziest socks, the craziest socks I ever wore. And when I was sitting there, I kept on swinging my legs. And when they broke for commercials, she saw my legs swing, and she saw those crazy socks, and she turned and smiled, and she did that
Oh, wow.
to me.
Yeah.
And the hope was I would be able to get to her.
Yes.
She would come over to me, because I was working with these two Rutgers grads who do stuff with tuition, college tuition. It's a long, I don't know why I'm going off on air like this, but anyway, and then the next commercial, she did that again.
Oh, wow.
I wanted to meet her and tell her what these amazing kids are doing, and then she got up and left.
Wow.
And end of story. But I was that. So I actually sent a picture of my socks to her office out in LA. I never heard anything. So be it. But anyway,
Still pretty cool.
I don't know why I went off.
That's
That. So let's go back to work. What are some of the common injuries that you see?
I'd say most common is just neck and back pain. So there can be, you know, a multitude of reasons. Sitting and posture is probably the biggest reason. You know, younger patients or middle-aged patients who are really active too, you know, tend to have a little bit of back pain. Neck pain you see a lot after a motor vehicle accident. So again, all different reasons, but neck and back are definitely my top two. The rotator cuff in the shoulder is a big one. You know, people tear, aggravate those muscles. Knee stuff, so some tears in the knee arthritis, just maybe some ligament sprains, not quite a full-blown tear. And then an ankle sprain. Ankle sprains are extremely common, you know, people who just kind of roll their ankle on the sidewalk. Those are probably the biggest. Yeah.
It's funny you said ankle injury. I was watching a thing last night. I missed the Olympics, and I love the Olympics, and I went back and I looked at gymnastics, and I watched actually this movie, Athlete A, women's gymnastics.
Yes.
And then there was Kerry Strug, who had a severe ankle injury, yet she did the vault and helped win the gold medal. It was kind of amazing. Anyway, I keep on going off on tangents.
Even this past Olympics, there was a Russian male who just had surgery on his Achilles tendon in his ankle, and I think they won gold for the team event, and he was flipping and jumping and landing on his ankle, and it was unbelievable.
So the surgery worked.
The surgery worked. It was a little soon after surgery to be doing all that stuff, but
wow.
I'm sure he had a great rehab team. So
interesting.
Yeah, very interesting.
Yeah, it is interesting. Actually, a little segue, just loosely, some tips for runners.
Sure. So thinking about injuries that I see with running, it's typically the lower half of the body, so hip, ankle, knee, mostly knee and ankle over hip, and hip weakness is the biggest cause of injuries in runners. So this kind of brings me back to the Pilates. You know, if we're using machines at the gym, or we're doing squats, or deadlifts, those are all good. They're not bad, but they don't work with the small muscles in the hip. So you have, a couple of glute muscles, they're smaller muscles, and you have to do specific exercises to work those muscles. So having a strong hip foundation is super important. If you're a runner, you can, just Google glute exercises or hip exercises, and they'll come up right away. So hip weakness is a big reason for injury in runners, or big cause of knee pain. So I would definitely recommend strengthening your hip, 2 to 3 exercises a couple days a week. And then making sure you're stretching or you're foam rolling. So your IT band, which is on the side of the leg, from the hip to the knee. So it's, you know, to the side of your quad muscle, that becomes pretty tight on runners. And if that's tight, it can pull the kneecap out to the side, and then you'll have poor tracking. It's a super common running injury. So either foam rolling your IT band, and then, you know, stretching the bigger muscles. So the quads, the hamstrings, the calf. So strengthening the smaller muscles, stretching the bigger muscles, basically making sure there's a balance. And again, if you don't run often, or you haven't ran in a while, just to start out slow and gradually increase your mileage, because a lot of injuries also happen kind of when you go from 0 to 100 a little bit too quickly.
Okay.
Yeah.
I marvel. Are you this is a little off topic too, but are you generally a fan? You know, this Molly Seidel won the bronze medal in the marathon, which is like amazing. She must be this. She just agreed to come to the New York Marathon.
Oh, she
A
did.
couple hours ago, I saw it. She's
Oh,
coming
wow.
to New York. But I marvel at her. Obviously, asking a doctor of physical therapy about being a marathon runner, you don't overly endure. I mean, how can you endure something like that? That is so terrible for the human body, correct?
It's a lot on the joints. Yes, it's a lot. Yes.
I can't even, you know,
Yeah.
I can't even imagine. I mean, not that these are big people, but to pound away for 26 miles.
Yeah.
And these poor, but anyway, she's an amazing athlete.
She is. And I would never, ever tell anybody not to run a marathon, but just give them the tools that they need to succeed and not injure themselves.
Okay.
But yeah, it's a tough thing, and you have to make sure your body can handle it.
Okay. Next, since we touched on it, but this is just generalized stuff, tips for overall health and well-being.
Yeah.
Good life.
Yeah. I keep going back to posture, but posture's a really big one. So, you know, just practicing good posture, you know, keeping your neck back, not getting into that position when you're doing work. And then, you know, just staying active, like you were talking about, and it could be as simple as walking. I mean, if you're not an exerciser, that's okay. You can, you know, just walk for 30 minutes a day. That's great. You know, cardio, any type of cardio, cycling, swimming is great. If you're more of a strength person, you know, to find something that you enjoy doing, because then you'll actually do it. But, you know, staying active, trying to practice good posture, you know, I'm a big fan of stretching. So, if you're really active, it's always great to take a rest or a stretch day. And if you're not so active, maybe try to incorporate a little stretching, but, a full body routine, maybe a little bit of beginner yoga, again, whatever it is you like the most. But, you know, keeping your muscles loose, staying active, practicing good posture, stuff like that.
Okay. You know, it's funny, you said swimming, and I was watching stuff about the Olympic swimmers, and it kind of blew me away that they burn thousands and thousands while they're training, thousands and thousands of calories per day.
Yes.
Swimming, I never knew that.
Yeah.
I think most of the world doesn't know how good swimming is.
It's great. It's great.
You know, some of these athletes they're eating 3,000, 4,000, 5,000 calories a day.
Wow.
And they're skinny as hell.
Yeah.
because the swimming burns so much.
It does.
Mention that. Okay, moving on. Just quick tips on of which I'm a huge. I'm in the club of pain relief. I'm at that age. Any tips to relieve pain? Let's say, I don't know, my knee, whatever, the back. I mean, these are very open.
Yes,
questions.
yes. I mean, generally speaking, I always, tell people, don't let the pain be your life or be your focal point. Don't focus on it. It's there for a reason. It's a warning sign. It's letting your body know that either something is wrong or you've gone too far, you've done too much. So it's important to listen to it, but not to focus on it. So if we're talking about a knee and you have knee pain with walking, I would encourage you to walk. Don't push into like that moderate or extreme pain, but walk as much as you can with minimal pain. Show your body that I can do this. Because if you start avoiding that activity, your brain kind of learns this pattern, and then your brain is always going to perceive that walking as painful. So you kind of develop those bad habits. Same thing with back pain. Let's say bending forward bothers your back. I would encourage you to bend forward, maybe only bend forward a little bit. Maybe have your hands on a surface while you bend forward for support, but do some modified version of it to get your body used to it. So again, you don't develop these fear avoidance behaviors and you just stop an activity for who knows how long. And, of course, some pain needs to be treated with physical therapy, with medication. So, there's things that you can do as adjuncts in the meantime while still kind of pushing into your limits and testing things out. But being active 100%, there's plenty of studies on it, helps with pain. As long as, you're listening to your body, you're not overdoing it, activity and movement is a good thing. Yes.
So it's the endorphins. Right?
Yeah, they help.
I wish I could go into a drugstore and next to the aspirin there's a bottle of endorphins.
Endorphins.
It doesn't work that way, does it?
No, it's a good idea though.
It's a great idea. Yeah, it's funny. I just read whomever, and maybe we're onto something now, Kelly. Whomever can come up with a way to add a year to lifespan.
Mm-hmm.
So interesting. Whomever can do that,
Yeah.
whether it's Jeff Bezos or Bill Gates or Warren Buffett, whoever can come up with a thing off the shelf that if you pop this, you're going to have a year extra of life.
Yeah.
That's worth $1 trillion.
Definitely.
That's what you just said.
Yeah.
Reminded me of that, the endorphins or for sale.
Mm-hmm.
So winding down, I do have another question because I know nothing about Kinesio taping and cupping. I don't know anything about that.
Yes.
Yet you do that, and it's important.
Yes. So, both I would say are adjuncts to physical therapy, to manual therapy, to exercise. So different benefits. I'm a big fan of the Kinesio taping. If you watched any Olympic volleyball, it was all over the volleyball players and some of the other athletes.
Yeah.
Yes. So
wow.
There are a ton of benefits, and it all depends on how you tape. So there's no medication on the tape. All the benefits have to do with the application. So if let's say you have shoulder pain, but you have a volleyball match and you need to play, there's ways to tape the shoulder to avoid further injury or pain. There's ways to tape the shoulder to keep it in alignment. This goes for any body part. And then there's ways to either activate or inhibit a muscle. So let's say you have an overactive muscle in your neck and you have a neck spasm. I can tape you to inhibit that muscle. Or let's say you have a weak shoulder rotator cuff and you need to to play in a game, you need to lift your daughter, I could tape you in a way to facilitate those muscles. So yeah, it helps with muscle activation, muscle inhibition. It helps decrease swelling. So I use it a lot for my post-operative patients. And then it helps with joint alignment or just keeping structures in place. So there's a lot of benefits to it. I'll try it maybe at the end of my session. It's pretty quick and easy. And if it doesn't, again, though, sometimes, people don't find a response from it. Sometimes they do. It doesn't make anything worse. So I typically try it. Yes.
I've never, and I've spent chunks of my life in PT. We've discussed that, chunks of my life, and I've never had that. And you just did this powerful visualization for me, the Olympics and the tape, and it's funny. It's so funny because I saw it, but I never went to Google to find out what the hell that is. And you just explained it to me, and how interesting.
Yes.
But it's like you're so state of the art. So I have one final perhaps silly. We discussed this honestly before we went on air, and you were very gracious to answer it. I showed you a product that a rubbing product for my bad knees.
Yes.
That had CBD in it, and I asked you what you thought about that. And you had a great answer.
So the most important thing to note is that it won't make anything worse. It won't hurt you. It's hit or miss. It depends on the person. Like you said, it's new. There's not as much research out on it. But we do know that it's not going to make anything worse. So, the worst thing that will happen is you purchase it, you use it, and there's no effect. It's not going to increase your pain. And ideally, it will decrease your pain or your stress level or make you feel more relaxed, depending on the kind you're using. But there are no negative side effects of CBD. So when my patients ask me, or let's say my patients have tried heat and ice and nothing is really working at night and they can't sleep, I'll typically recommend it.
Okay.
Yes.
So I'm gonna go back to using it.
Yeah.
On my
Try
knee.
it and try it a few times, because you might not know after
Yeah,
1 or 2 times.
I will. I absolutely will. So this has been great.
Yes.
And I have to say, I have learned. I thought I knew it all when it came to PT, but I didn't. And you were so gracious and so illuminating, and you really taught me a bunch of stuff that I didn't know, and I can't thank you enough, Kelly, for this time. And we discussed this before. Ever you want to come back and chat about things and do panel, whatever your imagination directs you to, I'm always here and so receptive and so appreciative to you, and I thank you.
Thank you. Thank you. Thank you for having me. This was awesome. Like I said, your channel is great. You have so many fascinating people. So I'm very, very excited to be a part of it.
Yes, you are, and a very important part of this.
Thank you.
It's a whole new world. So thank you, Kelly. To be continued. I always like to say that, to be continued.
Yes.
And I'm gonna sign off.